Welcome back to the Dave Elswick Show. That is the best intro. You know, I had never heard, I didn't know where that song came from. And I've listened to Dave for like 20 years. And I was walking through an airport or something one day. And I was like, oh my gosh, they're playing the Dave Elswick theme song. And I had no, is it AC/DC or something like that? I don't even know. But apparently that's a very popular song. And I'm probably showing my age and the fact that I was homeschooled. Very sheltered upbringing. But hey, it's Nic Horton guest hosting for Dave Elswick. Dave, I hope you're having great time off, getting some time away from the busyness and the chaos of the radio industry and recharging. I'm going to hop right into it. We got a little bit of a short segment here on the front end, so I want to go ahead and introduce our very special guest, Dr. Brian Blase, the president of the Paragon Health Institute, longtime healthcare advisor in the White House. Brian, thanks so much for joining us today.
Hey, Nick, great to be with you.
Hey, it's great to have you on. So tell us a little bit. I know Paragon, I mean, you guys came on the scene not that long ago, but you've made such a splash that it feels like you've been around forever. But I'm not sure in Arkansas, in this market, how familiar people are with y'all's work. So tell us a little bit about Paragon, what you guys are focused on, and kind of the origins of your organization.
Sure. We just brought on to the team a great research fellow, too. So, Nick, we're glad to have you as part of the team. Those of us that support free markets and limited government and have an interest in public policy have too long neglected the importance of health policy. And I think during Obamacare, Republicans and conservatives knew that they were opposed to it and came up with a repeal and replace slogan. But what we need to do is put meat on the bones, have policies that go with an agenda that promotes consumer choice, market competition, really limited regulation, so that people are free and people can innovate to create the products that are needed to improve our patients' health. We've got major problems with our entitlement programs. Medicare and Medicaid just aren't delivering value for the tremendous expense that they put on taxpayers. So we need to be in the game, and Paragon, I formed Paragon and put together a team that has worked many of them has worked at senior levels in government. They know how to change policy. They know what the problems are, and we need to be able to put forward, free market alternatives to government's current programs and policies.
Yeah, well, very well said, and I think you're going to have a lot of success with that message, particularly in Arkansas, because I think a lot of people are catching on to this problem of 1.1 million now, 1.1 million people in a state of 3 million people that are dependent on Medicaid, and everybody wants the program to be there for people that really need it, but if we have everyone on the program, we don't have anyone paying for the program, that sort of becomes a problem at some point. So I know, Brian, a lot of your expertise is at the federal level, but I know you also have really your finger on the pulse of what's happening in states. So on that topic of Medicaid, again, we're facing a lot of challenges with that in Arkansas. What are some things? We got a legislative session coming up. We've got a new governor coming into office. What are some things state policymakers should be thinking about going into our legislative session in terms of how to fix Medicaid and make it more sustainable for people that really need it?
Yeah, Nick, well, you hit the nail on the head. I mean, the real problem is enrollment in Medicaid, and it's not just Arkansas. I mean, it sounds like in Arkansas, more than 1 in 3 people are on Medicaid, and that's an issue in a lot of states, particularly states that in my view, adopted Obamacare's Medicaid expansion, which was, deeply problematic and takes resources away from the people that really need the program, the low-income pregnant women, individuals with disabilities, and expanding the program to able-bodied working adults and crowding out services for the truly vulnerable. What states need to do is eligibility determinations. One of the things that the states should certainly look at is starting eligibility determinations right away. There is a federal provision of one of the original coronavirus relief bills that essentially bribed states not to do eligibility determinations by paying states greater money from Washington. I think the reality is for a lot of states, they're not getting them as much money from Washington as they need for the expense of people who are enrolled in the program who are no longer eligible. Nationally, we estimate that there's about 20 million people enrolled in Medicaid that aren't eligible for the program. Many of them have offers of employer coverage, and it's appropriate for them to be on employer coverage. So I think properly determining eligibility, evaluating whether it makes sense to continue with the sort of COVID policy that prevents states like Arkansas from doing eligibility determinations, and then just auditing where the money is going. I think we're losing a lot of money to insurance companies that are managed care for Medicaid, and states should do deep dives to understand exactly where all the taxpayer money is going.
Yeah, those are really great suggestions. I know we've got a lot of state policymakers that listen to this show, and if they want to learn more about what you're talking about here, particularly Medicaid, I mean, the president said the pandemic's over, right? So, why are we still keeping these Medicaid handcuffs on states and not doing eligibility reviews to make sure that people who are ineligible are not, taking resources away from people that are truly eligible? Brian, we got to go to a hard break, but if people want to learn more about your organization, where can they do that?
They should go to ParagonInstitute.org. You can Google Paragon Health Institute, get on our website, and check out sort of all the products and research that Paragon has been up to, and all the great staff that we've brought on board as part of the Paragon team.
Yeah, that's great. Thanks so much, Brian, for joining us. We got to take a break.